Hello, my name is Rebecca Harper, and this is my presentation on patient-centered care. In order to provide culturally competent care, I wanted to do my presentation on ageism. Ageism is discrimination against people that are older. We need to take into consideration that people are living longer lives, and that they are often healthier at an advanced age. People who took care of themselves, they didn't smoke or drink, they exercised regularly, and they ate good food, may be quite healthy at their older age. The patient I am focusing on is Mr. Sam Buckmaster. He is an otherwise healthy 80-year-old man. He is a retired psychologist, and he travels around the world and into remote regions to provide care. He has taught monks in Nepal how to do EMDR therapy for people that are suffering from PTSD. He has also been to Afghanistan, where he has taught nurses to do the same. Sam has had episodes of high blood pressure for about 10 years that he didn't take seriously. He didn't take medication regularly or see a provider or get lab work. He started having about 2 months of weakness when he was around 78. He returned to the U.S. and he was diagnosed with renal failure due to bilateral renal artery stenosis. He was told that he would need to either have renal dialysis or peritoneal dialysis, and a peritoneal catheter was placed, and he returned to Mexico, where he took care of this himself. He developed an infection and ended up returning to the United States. This was about 7 months after the original diagnosis. Another doctor asked why they had not tried to revascularize his kidneys. They still could see kidney function, he was still making urine, so they did a renal artery bypass graft on him for both kidneys. He had significant improvements, but he still needed occasional dialysis because his creatinine would continue to climb. He returned to Mexico, where he continued to hike, but he could never travel very far from a dialysis center. So he decided to consider kidney transplant. He went to Minneapolis, where he was worked up, and he was told that he was a candidate to receive a kidney. However, they said he was too old to be placed on the national transplant list, and that he would need to find a living donor. His adult children were ruled out as potential donors because of their own health issues. He asked among his acquaintances, friends, to try and see if he could find a donor. He did have a man that was wanting to donate to him. After about 2 months of workup here in Tucson, Arizona, he was then told he was not a candidate due to his age, as he was now 80. This is age discrimination. Mr. Buckmaster has led a very healthy life. And if you were to take somebody that was 40 or 50 years old that did not take care of themselves and had advanced diabetes, terrible high blood pressure, they may not be as good a candidate as Mr. Buckmaster, and you might get more years out of that same kidney if you were to give it to him. From the patient's perspective, there would have been better outcomes had Sam taken his high blood pressure a little bit more seriously, if he had been diagnosed early, and maybe he could have been treated. The diagnosing physician should have offered bypass grafting early when he was first diagnosed, and perhaps he would have retained more of his kidney function. And finally, the transplant decision should not have been based on his age. Mr. Buckmaster is applying to Minneapolis again to see if they will approve of him. We need to realize that we are dealing with an aging population, and that really is all of us. We are all getting older. We need to look at the risk versus the benefits of treating people. John Hopkins says that we should base our decisions on a person's frailty, which were measurable, and not on their age. We need to reconsider some of our outdated thoughts about aging. We base our decisions on whether or not to do mammograms anymore on a patient's age, and they look as that as to whether or not they were diagnosed with something, how much longer they would live if they had that diagnosis versus a natural death. But if somebody was going to live to 100 or 110, perhaps we should be doing these things later. Another consideration is stopping statins at a certain age, where these people may continue to benefit from them. So it needs to be based on an individual basis and not on a person's age. Does anybody have any questions? If so, please post them at the bottom of my presentation. These are my references. Thank you very much for listening to me.